Tonight, confusion growing over how much longer long-term care staff and residents will be able to get the COVID-19 vaccine inside their facilities. This especially after so many long-term care workers have rejected the first round of shots.
Well, hello. Are you ready?
During this vaccine clinic at Grand Villa Assisted Living Facility last week,
You're set to go. You're welcome, Aaron.
second dose shots were first priority when we stopped by.
Next 7-5.
By day's end, the majority of these Sarasota residents fully vaccinated.
Okay, so you have to fill out one of these.
As for staff,
not too many staff members, me included. I opt out to get the shot because back in June I had COVID.
Latoya Wright is a nurse here and among the estimated 70% of staff at this center who have said no to the COVID-19 vaccine.
It won't protect me from not ever getting it again. I just feel like I believe in God and He brought me through having COVID. He'll bring me through this.
Statewide, nearly 70% of the state's 200,000 long-term care staffers have rejected the vaccine.
The problem with staff not getting vaccinated is, of course, they're probably our largest source of bringing COVID into the communities.
Jennifer McConnell, Assistant Director of Quality Assurance, says it's a similar picture at all 18 Grand Villa Assisted Living Centers across Florida.
I thought that staff members would be standing in line asking for the vaccine when it became available. It is a little disappointing.
Now she has reason to fear the number of unvaccinated in her facilities is going to get worse.
There's an issue with, how are we going to get those people vaccinated?
Since last month, long-term care centers have relied on federal or state-run vaccination clinics like this one to get residents and staff their shots quickly. But these clinics end this month, leaving anyone who didn't get a shot to join the masses struggling to get appointments on their own.
When we have new residents moving in, those residents can't get vaccinated out into the general public. Or new team members coming in, it's very difficult for people to get vaccinated out into the general public.
It's a concern the industry doesn't have a clear answer for. A spokesperson for the state's Nursing Home Association told us this is one of the many reasons we continue to do promotions in our facilities, working hard to encourage staff to get their shots.
It's just too unpredictable right now.
Latoya Wright remains in a wait and see.
I'm not saying that I won't, but I just won't get it now.
Beautiful. Look at me.
But it's the wait and see industry leaders are afraid of.
Wait, am I done? 15 minutes?
If staff don't get vaccinated, I really and truly don't think we'll ever get back to normal.
After we shared with the state concerns facilities had about the end to these vaccination clinics, a spokesperson from the Department of Health told us they are extending these clinics to ensure the most vulnerable have access to the COVID-19 vaccine as quickly as possible. Katie LeGrone, WSFL TV.